Hi everyone, Dr. Sylvestre here. I'm going to do a mini-series, I'm going to call it, on referrals. In this mini-series, there'll be a variety of topics. I also want to delve into things like what's the difference between a board-certified surgeon and a general practitioner trained to do a certain procedure. How to refer a case, who and when should the case be referred, how to follow up, how to prepare a client for a specialty appointment. I know that there are probably going to be some pet owners that are going to follow this series as well. So I'm going to start the first one with what is a veterinary specialist? In veterinary medicine, we have many specialties. Surgery, my specialty. Anesthesia, internal medicine, ophthalmology, cardiology, critical care, dermatology, and there are many more. In order to be recognized as a specialist in North America and Europe, we have the same or similar process in these two continents. You need to go through quite a rigorous process. After receiving your DVM degree, in order to become a specialist, you have to do at least 1 year, often 2, of a rotating internship. Once the rotating internship is complete, you then need to do a residency program within your specialty. The rotating internship is a 12-month program usually, and it's usually held within a university or academic veterinary facilities or a large referral multi-specialty hospital of some sort. So you need to have various specialties. The intern will then rotate through all of the different specialties that are offered within at least their facilities to really get a good feel of surgery, internal medicine, cardiology, ophthalmology, whatever they're rotating through, to get a good feel of that discipline. So they usually shadow the specialist or maybe the senior resident in that specialty in order to really get a good feel of the discipline, but they tend not to have primary case care. And with an internship, there's often, assigned readings involved and case rounds and all sorts of different ways to ensure that the person doing an internship is really getting a lot of information and value out of their year. Because trust me, they are not paid a whole lot of money, and sometimes, depending on where they're doing their internship, they have to pay tuition fees. Once the internship is done, then that person, if they wish to specialize, can apply for a residency program within the specialty that they are choosing. So let's say they want to be a surgeon, and then they're going to apply to a surgical residency program, again, either in a university setting or a large specialty referral hospital setting. A residency program is usually 3 years. It might vary a little bit based on the discipline and where you're doing it. In my case, I did a surgical residency. In my 3 years, I did see cases myself, so I had primary case care, but all of my cases were discussed with the surgeon, the board-certified specialist that I was directly working under. And I would assist this surgeon as well as other boarded surgeons in surgery. Once I had seen these cases several times and assisted many times in surgery, I would then have the opportunity to do part of the surgery or most of the surgery myself, but I would have that surgeon there to help guide me and make sure I was doing the right step at the right time. And as I got more experience, I would just be taking the case to surgery myself. But if I did have an issue, my advisor my supervising surgeon was always close by and would come in and help out. That's how you learn, and that's a comfortable way to learn because you know that you always have a safety net. During my residency, I also needed to rotate through other disciplines. So at least in a surgical residency, one needs to rotate in other disciplines. Anesthesia, I did a fair bit of neurology, internal medicine, critical care, just to make sure that we are getting nice, well-rounded education in disciplines that will directly affect us. I also had courses I had to take, some fracture repair courses, epidemiology courses, and we have to, in surgery anyways, conduct a small research study and actually publish the results of that. So these were necessary criteria during my 3-year residency program to become a surgeon. I had to keep a log of all of the surgeries that I did, and I had to meet certain criteria for certain surgeries. I had to do, so many fracture repairs, so many GDV surgeries, etc. So the log is there to have an idea of what you did, but also ensure that I had sufficient number of cases within the different disciplines. There are also organized case rounds discussion every week, as well as journal rounds where we would discuss different journal articles and make sure that we were comfortable with the jargon and what we were reading and the interpretation of the results of the different studies that we would read, so that we knew that the information we were getting was good information. In North America and in Europe, after the residency program, there is an exam that you have to take. The exam is usually offered only once a year. In surgery, it's a 3-day event. It takes a lot of preparation for this exam. And what the exam does is it really forces us to understand the material. It forces us to read all of those journal articles, to read and make notes of what's in the textbooks, and just to really understand the pathophysiology of the diseases, the biomechanics of fracture repair. There's a lot of detail in there, and it's our opportunity to really just sit down and learn that. Most candidates for the exams will be studying for a good 6 months before the exam, and often will take 6 to 8 weeks off of work and do nothing but study for the exam. So it is a serious set of circumstances, a stressful time, shall I say, the board exam. If you don't pass the board exam, there's often an opportunity to write it the following year. In surgery, there's a limit to the number of times you can take the exam. I'm not sure about the other disciplines, but in surgery, it's 3 times. If you don't make the passing grade in 3 times, it becomes a much more complicated process. Once you've passed the exam, then you are considered a board certified specialist of whatever discipline you selected. The way to think of a specialist versus a general practitioner is think of the specialist as somebody who knows a whole lot, a big depth of information about one topic, whereas the general practitioner knows a smaller amount of information about a lot of topics. And that really is where the difference lies. So if you come to see me, a surgeon, and your dog happens to be itchy, I don't recommend you ask me about skin products and why the dog might be itchy. Your general practitioner is going to do a way better job with that. But if your dog is lame and it's not responding to a pretty general lameness treatment, then I'm your gal. My next topic is going to be the difference between the board-certified surgeon and the general practitioner with an interest in surgery and that has, taken some extra training, some advanced courses in various surgical procedures. What's the best way to use the skill set in these two differently trained veterinarians? Thank you for listening. We'll talk to you soon.